Reports of this Kaleida-operated outpatient surgery center in Amherst shutting down, along with 2 therapy clinics, may have been in the works as healthcare system executives work on their corporate budgets, as one In Touch state lawmaker told us over the summer about Medicaid cuts filtering down.
Each hospital in Western New York has already been planning their strategy on how they're going to deal with the impacts of these cuts on their ability to deliver services. And they should. You can't wait till it happens to you to figure that out. You need to start thinking about it now. And most hospitals I would say in the entire state, but definitely in Western New York, are already doing that.
Former Buffalo General Hospital President Larry Zielinski, who is now a consultant for a primary care physicians group, says the older surgery center, competing with more doctor-owned modern facilities, and the lower reimbursed therapy clinics were cost-cutting targets, even if the upcoming federal Medicaid reductions are spread out over a decade.
But there are impacts that are going to take effect in 2026 that are substantial. And they're just trying to get a head start on trying to make up for some of these budget reductions with these moves that they've made with the surgery center and these 2 clinics. And I would anticipate more coming down the pike.
Zielinski agrees there will be a balancing act for major hospitals as they see more poor health patients with less or no Medicaid coverage crowding their emergency rooms. Perhaps even more so if rural hospitals suffer financially, even as some additional federal funding for them was included in that budget reconciliation bill passed earlier this year. So for a high Medicaid cost state like New York, and with many Medicaid patients in our region,
but it's still several $1 billion of lost revenue. It's going to take a multifaceted approach for these hospitals to stay solvent. So they are nibbling around the edges. There's not going to be significant savings in these recent reductions. So this is going to be part of a broader cost reduction plan.
Now, Larry Zielinski also says be on the lookout for major increases in our health care coverage insurance plans in the coming years as those Medicaid reductions start to filter in for the hospitals. We're going to be checking more into that. On your side, Ron Plants, Channel 2 News.
Thanks, Ron.